What is the concept of Anukta Vyadhi? When an individual is coming to you with the no proper diagnosis of the disease, how that has to be progressed, that is the topic of discussion in this particular video. That is, when an expert clinician is having a confusion regarding the diagnosis of a disease, how to progress from the patient interaction, that is the topic of discussion in this particular video. Dear ANA community members, press the like button and spread this particular video to maximum number of true Nidana learners so that we can make a huge movement out of this particular small message. Don't forget to press the bell icon so that the YouTube algorithms will be fetching you the right information at the right time for the right purpose. When you think about the term Anukta, that refers to the disease that is not being mentioned in Ayurveda textbooks. When you think about the description in Sushruta Samhita, it is being mentioned, Nasti rogo vina doshe yasmat tasmad vichakshanah anuktam vidoshanam lingaihi vyadhimupachare na asti rogo vina doshaihi yasmat tasmad vichakshanah anuktam api doshanam lingaihi vyadhim upacharet. So whenever if you think about the detailed description of this, Nasti rogo vina doshaihi yasmat tasmad vichakshanah. It is being mentioned that there is no disease that will be manifested in an individual in the absence of vitiated dosha. Hence, whenever if you think about the diseases that are not being mentioned in the textbooks, that is says the second line, Anuktam api vyadhim doshanam lingaihi upacharet. Whenever the Anuktam Vyadhi that is not being mentioned in the textbooks, Doshanam Lingaihi, so that has to be identified by the Lakshana that are being seen in the body regarding the vitiated dosha, regarding the abnormality, functions of the dhatu, etc. That has to be noted there. So this particular discomfort, that is what is Linga or Lakshana, that may show either abnormality in the function of dosha or dhatu or mala. The same thing is being described in Ashtanga Hridaya, Rogastu Dosha Vaishamyam. The abnormality of the dosha may be in the form of either increased dosha or decreased dosha, increased vata or increased pitta or increased kapha, or otherwise decreased vata or decreased pitta or decreased kapha, or in any one of the or two or more combinations are being present, that is considered to be Roga. And when you think about the significance of Anukta Vyadhi, the first and foremost thing that the diagnosis of a disease, that is very, very important. If you are able to diagnose the disease accurately, then prognosis of the disease that can be done essentially or very easily. And if the diagnosis and prognosis of the disease is clearly made out, then proper management of the disease can be considered and proper recurrence of the disease can be prevented. So that is the main significance of knowing about the Anukta Vyadhi. So regarding the how to know about the Anukta Vyadhi. So that is we have said doshadhinam lingaihi. Now identifying the linga. How you are going to identify that? That is being identified by aprasannendriyam. Doshadhinam tu anuva asamatam anumanena lakshayet. Aprasannendriyam viksha purusham kushalo bhishak. Aprasannendriya, that is dysfunctioning of indriya or poorly functioning of indriya, or the person is having the discomfort in doing the functions of the indriya. So that is indicative of the abnormal functions of dosha, dhatu or mala. So whenever we think about the aprasanna indriya, that can be either aprasanna jnanendriya, the shrotra, the person is unable to hear properly, or taste perception is difficult, or the person is having sensory perception in the skin that may be difficult, vision disturbances are there, or the smell perceptions disturbances we are going to notice, all they are indicative of a jnanendriya dysfunction. Whereas karmendriya dysfunction, where the person is unable to produce the sound properly, the person is unable to hold the objects properly, walking or running is difficult in case of pada indriya. The person is having the, what do you say, that the dysfunction related to defecation, etc. That is indicative of a payu dysfunction. And the person will be having the sexual dysfunction in case of upastha dysfunction, wherein the person may have the both jnanendriya and karmendriya dysfunction individually in a single patient at a particular point of time. In that particular situation, we have to know about the jnanendriya karmendriya dysfunction that has to be properly identified to make the diagnosis of the disease as such. Further, ubhaya indriya, that is manas dysfunction, that has to be noted. That will be giving us the idea of abnormal proportions of dosha dhatu mala present in the body. As far as the diagnostic approaches are concerned, basically two types of approaches are there. That is intuitive approach and analytical approach. Intuitive approach, that is also being termed as system one thinking, but analytical thinking, that is also being termed as system two thinking. Intuitive thinking in the sense we are having the properly knowing that some of the informations, by seeing the presenting complaint we are in a better position to make the diagnosis properly. That is indicative of intuitive thinking, or what we can say systemic thinking. Whereas analytical thinking, that is system two thinking, where the person is going to hear the information for the first time, then we are going to analyze the clinical symptoms retrospectively. When you think about the coronavirus or COVID-19 pandemic or an epidemic outbreak, at the time of the 2020, during the first outbreak of this particular disease, that was the diagnosis was basically related to intuitive type. Whereas now, if you are the second or third episode of COVID, in the first instance, that is considered to be the analytical thinking. When we speak of the diagnostic approaches for the diseases, two types of the diagnostic approaches are there. One for the Ukta Vyadhi and second for the Anukta Vyadhi. When you think about the Ukta Vyadhi dysfunction or diagnosis, that is the intuitive thinking or system one thinking that will be helpful. So that is, we are knowing the proper pathological events, and thereby by seeing the presenting complaint we can able to predict what might be the possible pathological changes that are happening inside the body that can be identified for Ukta Vyadhi. That is what we can say the intuitive approach. Whereas if the person is suffering from the disease for the first time, then we have to go for the thorough patient examination. So the or accurate history taking, that is indicative of analytical approach, or what we can say system two thinking. So Ukta Vyadhi requires intuitive approach, whereas Anukta Vyadhi requires the analytical approach. Regarding the method of Anukta Vyadhi diagnosis, these are the possible ways where we are going to identify the Anukta Vyadhi. For example, dosha afflicted in the disease progression. We need to identify the possible dosha afflicted. For example, if the person is presented with the Karshya Karshni Ushna Kamitva Kampa Anaha Shakragrahan Bala Nidrendriya Bhramsha Pralap Brahmadinatah, they are indicative of Vata dosha dysfunction or abnormal vitiation of Vata dosha in the body. श्लेष्माग्नि सदन प्रसे कालस्य गौरवम शैत्य शैत्य शतांगत्वम श्वास कासाति निद्रता. This is indicative of kapha dosha aggravation or increased kapha dosha in the body that we can able to analyze. regarding the dusha afflicted. So we need to know about the dhatu as well as mala affliction has to be known. If the person is presented with asti adhyasti adidantamsha, then we are going to suspect the person is having asti dhatu increase in the body. Or if the person is presented with asti nam astitodah sadanam dantakeshanakadishu, this is indicative of what do you say that the asti dhatu as well as majja dhatu dysfunction, we are going to predict that. Further, we need to know about the srota afflicted that has to be identified. Srota dushti type that has to be identified. Type of the Agni dysfunction. Whether the Agni is present, dysfunction is present in the Amashaya, or whether is it present in the intravascular compartment or interstitial compartment or intracellular compartment, that has to be known. Type of the ama in the body. Whether is it present in the alimentary canal or in the intravascular compartment, interstitial compartment or intracellular compartment, that has to be known. And Udbhavasthana, where the dosha accumulation is being taking place. Whether is it in the amasha or pakvasha, that has to be analyzed by proper interaction with the patient. Sadhya sadhya assessment, by knowing about these above said parameters, we have to make the diagnosis of the disease, whether it is curable or incurable, that has to be known. And Roga Marga assessment, that has to be analyzed. If you are able to give the documentation for each of these points, then we are moving in the right direction as far as the diagnosis of the Anukta Vyadhi is concerned. As far as prognosis of the Anukta Vyadhi is concerned, we are going to make the appropriate step towards that. Regarding the different examples, in this particular example, the twak is being afflicted. So that is Sparshanendriya dysfunction. So in that particular sense, we are going to expect the here the depending upon the discoloration, we are going to suspect pitta dosha increase in the body. In that way, that is the aprasannendriya that can be analyzed. So here the person is having the involuntary movements. Involuntary movements are indicative of the vata prakopa, kampa anaha. So that is vata prakopa, kampa. So that is indicative of the chalaguna increase of the vata dosha. We are going to predict that. To sum up, Anukta Vyadhi requires Nasti Roga Vina Doshi Yasmat Tasmad Vishana Anuktam Api Doshana Lingar Vyadhi Mupachare. So that is, no disease will be manifested in an individual in the absence of a vitiated dosha. And these vitiated dosha are responsible for the certain types of the lakshana present in the body. So these lakshanas will be identified by aprasanna indriya, which will be helping us to know about the abnormality of the dosha or dhatu or mala. Doshadinam to samatam anumane nalakshayat aprasannendriyam viksha purusham kushalo bishake. And as far as the diagnosis of the Anukta Vyadhi is concerned, Anumana and Aprasanna Indriya that play a major role in the diagnosis of the Anukta Vyadhi. That's all for today. What are the major key takeaways from today's discussion? Mention in the comment box below. What is the one video that like to share in the comment days in this particular channel? Mention in the comment box below and spread this particular video to maximum number of true Nidana learners so that we can make a huge movement out of this particular small message. That's all for today. Something more in the next video. Thank you.